Welcome to the WIKIVET channel, the ultimate source of information for all things related to veterinary medicine and animal care.
Oh, snake! 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 Snake!
Snakes!
Snakes! Snakes! Snake bite! Snake bite! Snake bite!
India is home to many species of venomous snakes, including cobras, kraits, vipers, and the Russell's viper. These snakes produce different types of venom, which have varying effects on their prey, including animals like dogs and even humans. Let's know about what is venom. Venom is a specialized gland and is delivered either by biting or stinging. Like a snake, in general, there are two types of snake venom, neurotoxins and hematoxins. The enzymatic portion of the venom produces nitric acid. Of the 3,500 types of snakes available, only 600 species belonging to 6 families are toxic. Mainly classified into 2 classes are one of the elapines, which include the cobra, mamba, and coral snakes, and 2 of the 2 families of viperines. O the true vipers, example Russell's viper, and a B of the pit vipers, example rattlesnakes. There are 4 common poisonous snakes in India. There are 1. Indian cobra naga, 2. Indian krait, 3. Russell's viper, and 4. Saw-scaled viper. Elapines, lapidae, or cobra, naga, mambas, kraits, and coral snakes have short fangs and tend to hang on and chew venom into their victims. The vipers have long and strong fangs that can easily bite through the clothes, unlike elapines, which have short fangs. Toxic components are: it is a complex mixture of amino acids, proteins, enzymes, biogenic aminos, metals. Enzymes contains about 26 enzymes. No single venom contains all of these, as some enzymes are present in all types of venoms. Proteolytic enzymes, e.g. proteases of the digest tissue proteins and ecogecela. Hyaluronides dissolves intracellular gel of the connective tissue. Rapid spread of venom, phosphomiciders, etc. Cobras and kraits produce neurotoxin venom, which acts on the nervous system, where cobra and kraits alpha and kappa bondoprodicts blocks a post-sympathetic acetylcholine receptor, and common krait venom blocks a pre-sympathetic, mainly beta bondoprodicts, causing paralysis and respiratory failure. The venom contains a protein called alpha-neurotoxin, which blocks the neuromuscular junctions and prevents the transmission of nerve impulses. This results in muscle paralysis, including the muscles controlling breathing, leading to respiratory distress and eventually death. Vipers, on the other hand, produce hematoxin venom. Hematoxin venom attacks the circulatory system and muscle tissue, causing coagulation, cardiopathy, and hemolysis. These bites are the most painful due to rapid death of tissues. This venom contains enzymes that break down the tissues and cause local bleeding, pain, and swelling. The enzymes in the venom can also cause the formation of clots or the breakdown of already formed clots, leading to coagulation disorders and internal bleeding. The Russell's viper produces a venom that is both neurotoxin and hematoxin. The venom contains a protein called crotoxin, which has both neurotoxin and hematoxin components. The neurotoxin component acts on the nerves, causing paralysis, while the hematoxin component affects the blood and tissues, causing local pain, swelling, and bleeding. Average time required to show symptoms after snake bites is: for Indian cobra 20 to 30 minutes, for common krait 6 to 12 hours, for Russell's viper 1 to 2 hours, for saw-scaled viper 30 minutes to 1 hour, for black mamba 20 to 60 minutes. Diagnosis: when an animal is bitten by a venomous snake, it's crucial to identify the species of snake and the type of venom produced, as this information will help the veterinarian determine the appropriate course of treatment. In some cases, anti-venom may be required to neutralize the effects of venom and prevent further damage to the animal. Treatment objectives of therapy are to neutralize the venom, prevent shock, and prevent secondary infections, and sometimes to prevent the further spread of toxins and remove the venom. Includes administration of the specific anti-venom as the species of snake is known. Administration of polyvalent anti-venom if the species of snake is not known and symptomatic. For example, total dose of 100 ml but 15 ml at the site of bite, and remaining if required, adrenaline 1000 to 0.5 to 1 ml is administered to counter hypersensitivity. Broad-spectrum antibiotics should be given to prevent wound infection and other secondary infections. Several potential pathogens, including Pseudomonas aeruginosa, Clostridium, Carinocosmatoria, and Staphylococcus respiratory assistance. Doses to prevent further damage to kidney. Tetanus antitoxin should always be given to the affected horse. Contraindications are not to do: applying alcohol, which promotes the entry of venom by vasodilating. Applying tourniquet, especially at face region and in bite of vipers, causes tissue damage. Overall, snake venom can have a devastating effect on animals, including pets and livestock. It's important to take precautions to prevent snake bites, such as keeping your animals under close supervision when outside and avoiding areas where snakes are known to live. If a bite does occur, seek veterinary care immediately to give your animal the best chance of making a full recovery.